My name is Tim Reha, host of Informed Health 2016 here at UCSF in San Francisco. Super excited to have Joshua Newman, very interesting character with there's just so many super brains here. You're the CMO and GM of Healthcare and Life Sciences for Salesforce, and you guys are a big supporter of UCSF here.
Very much so. We've done work with them for many, many years now, and I think we got to give them credit for being some of the pioneering healthcare organizations that we know of that have really pushed Salesforce into their enterprise and are doing a lot of different things with it.
What's your background and what are you doing with Salesforce?
I'm a family physician, and I was a geek by nature. I was building systems back in medical school and residency. I did a Robert Wood Johnson Clinical Scholars Program in health services research to get a sense of what's really happening in healthcare. And I think I'm just, by nature, a little frustrated with how the systems were, and so I wanted to make things better. Someone told me about Salesforce. I got introduced to Mark, and it was at a time when Salesforce was really interested in doing more in healthcare. We've been doing a lot in healthcare for the whole time I've been there, and the whole time of the company's been around. We started with helping sales, and we've gravitated more and more towards helping people relate with patients, manage patients, non-clinically and clinically now.
So I use Salesforce with my clients, great suite of tools now. And so inside, what was happening on stage and what were some of the speakers there and topics that you guys were passing around?
The session was about big data, and it was about ways of using data and analytics for healthcare, but really trying to inform it from outside of healthcare. So we had a few different speakers, one of them from Twitter, one of them from Cisco, and a third from Intel. And they all had different takes on how to use data, what kinds of data sources to use, and how it can be brought to bear on use cases outside of healthcare. And the whole crux of the session was, how do we take some of those lessons and apply them to healthcare? One simple example was the gentleman from Twitter was talking about how you reach out to retail customers and how you understand who they are so you can give them a more tailored experience that helps with your goal of, in this case, selling them something. But if you take that same model and you apply it to healthcare, then imagine how well we could understand a patient if we used a broad range of data, and how well not only could we understand them, but maybe we could do a really good job taking care of them and helping them be healthier.
As a physician, we've seen it's almost like a military person where all these companies are trying to put more and more gear on them and things like that, and physicians have a lot of paperwork and things like that. What frustrates you, and where do you see that you can help in the future with Salesforce and some of the new technology and systems coming out?
You know, you're really calling out a very important issue, and this is the amount of work, the amount of expertise needed, and the time, the limited time that people have to do this. One of the really positive visions that I see for how we can maybe have an impact and how other technologies like us can have an impact is in distributing the work. When I trained as a family doc, I was trained basically to do the whole thing myself. We were taught how to deliver babies, how to give counseling, how to change people's nutrition, how to do procedures, how to take care of chronic disease over many, many years. And right now, I think we realize that there's so much expertise in any one of those activities that it takes someone whose full-time job is that, but we don't really have the systems for collaboration. We don't have the systems to keep people safe and to make sure the handoffs are going to work out okay. So I think that there's a great need for technology to help distribute the work across all the different people that can either do it really well or do it in an economic and efficient way, and take some of the workload off of the doc. Now, docs like me and a lot of my colleagues never wanted to share the work because we have high standards and we want to make sure that everyone does the work in a way that we would do it. Technology can help us do that.
So that's really cool. What are you seeing as 2016 is coming out? We're seeing a lot of partnerships here with UCSF and a really cool ecosystem. What is Salesforce doing specifically to enhance the informed health space?
I agree with you that there's a lot that's changing, and this is a really exciting year. This is probably one of the most, if not the most exciting year that we've ever seen in health IT, and because one of the examples is this whole Informed Conference. The idea of bringing industry into healthcare to help give some information and insight. What we see more and more is hospitals and health systems adopting the tools, the thinking, and some of the effectiveness that we've seen outside of healthcare and all these other businesses that have to compete and have cost pressures starting to come into healthcare. So that's one piece, and we sort of do that a little bit. The other thing that we've announced back in September is a new product called Health Cloud. We've taken Salesforce and we've customized it and we've built on it and we've improved it to make it much more credible for the healthcare enterprise. We're very excited about that.
Very cool, very cool. What are some other, what are the types of people you're looking for here at the conference to connect with or out there on the internet that could connect up with you and work with you guys and collaborate at Salesforce?
That's an interesting question. We're pretty open. As a company, I think we're really interested in folks that have a vision towards making things better. Fortunately, there are a lot of those people. We're looking for people that are frustrated with the current status quo, people that have the hope and the wherewithal and maybe the actual mandate to make things better. But frankly, I think every one of us, anyone who's watching out there, has a perspective, has a personal experience, has a loved one who has a personal experience. The cool thing about healthcare is that it's nonpartisan, and every single one of us touches everyone, but we also, all of us have a sense of how it could be better. And we can all contribute to it in whatever way that we have, even if it's just talking to our doctor and asking for a mobile device or a mobile app, all the way up to CEOs and chancellors and physicians who really have the power to change things from the inside.
When was the last time you went surfing? No, just kidding. We were talking about surfing earlier. Yeah.
Too long ago. This is a good work that I'm doing.
Awesome. Well, how do people connect up with you?
There's a lot of information about me online. There's plenty of LinkedIn, the web. We are in a mode right now of sharing our message and sending it out there. It's pretty easy to get in touch with me. We've got a great team of folks. Salesforce is a very visible company, and we'd love to hear from all the different folks who want to help contribute to what we see as a fundamental change in this great industry.
And it was really cool to see the opening last year here where you have the whole new hospital and you guys funded a lot of that.
Well, our CEO, Mark Benioff, made a very generous philanthropic donation to the UCSF hospital, and the name of it is the Benioff Children's Hospital, UCSF Benioff Children's Hospital. And it's something that I'm proud to work for a company with a chairman and CEO who has shown so much personal commitment, and then as a company, that commitment and that devotion to making the world better is something that pervades our entire company.
There you have it. Great guests, awesome topics. That's Joshua Newman with Salesforce. And nice to meet you, and I hope you get out on the board later today or tomorrow this weekend.
Thanks a lot, Tim. Appreciate it.